Okay, good morning. And can you see the the PowerPoint on your screen?
Yes, we can.
Okay, very good. So Spencer, in the next sort of 15, 20 minutes, Spencer and I will sort of pass the baton back and forth a little bit between the two of us. So we were part of a collaborative team that involved a number of researchers that were financed by the US FDA. And that work that we completed maybe 4 months ago was geared toward increasing the awareness of policymakers of the socioeconomic impacts of foodborne hazards in low and middle income countries. To strengthen the rationale for increased policy attention and public resources to enhance capacity and incentives for safe food, to provide some guidance on how to go about doing this, making some distinctions between countries at different levels of economic development, and to try to communicate all this in a language that would be readily understood by non-specialists, particularly ministries of finance. So it was a bit of a combination of a research and an advocacy piece. We did not set out to do sort of work in the benchmarking realm, but we sort of stumbled upon the topic because we found that really a dearth of reliable data in the public domain related to either the food safety status or performance in a large majority of countries. And that really constrained our analysis and ability to relate capacity and performance. So that's just a bit of background. So we'll give a little bit of highlights from the report that relate to the topic, and we'll bring up some themes related to the benchmarking topic. So next slide, Spencer. So if we wanted to summarize in sort of 4 main messages from the work, we very much see food safety as a mainstream economic development issue connected with the achievement of the Sustainable Development Goals. But it's not widely recognized as such. And when food safety has been on the development agenda, it's been predominantly in relation to trade, where the impacts have been more visible and the stakeholders better organized. When it comes to domestic food safety in developing countries, the common pattern is one of a policy vacuum, and sort of divided leadership, a data void, and generally a pattern of underinvestment. And where we see concerted action, it's normally reactive rather than preventative. That is more in the mode of crisis management than risk management. We see throughout the developing world a gap between food safety capacity and the actual need to manage food safety risks. And this gap is especially problematic in the rapidly changing, rapidly urbanizing lower middle income countries. And we see them as sort of the hotspot for global food safety now. And for these countries, basically a business as usual in the approach will result in very large future public health and economic costs. Yet many of these costs are avoidable. And we see evidence from some good practice where preventative public policy measures, smarter investment, and shifts in the approach and in the regulatory approach and the relationship between government and other stakeholders brings considerable benefits. Next slide. So when we looked at the costs of unsafe food, it looks like an iceberg where you have the visible part of it above the surface that relates to trade is of relatively modest size, and the part below the surface, which is huge, and this is the domestic food safety costs, often unmeasured and uncounted. And the sort of back of the envelope calculations we made using the data of the FERG group and using some economic indicators, we've estimated about $110 billion a year as the cost for developing countries from unsafe food. and the domestic cost being about 20 times that of the trade-related costs. About 2/3 of the global costs amongst developing countries is in Asia, and then Africa also has a significant total. Next slide. So one of the things we did sort of conceptually is try to look at the burden of foodborne disease from an economic point of view across countries at different levels of economic development. So here we have sort of 4 categories of countries, which more or less correspond with low income, lower middle income, upper middle income, and high income countries. And we postulate basically that the relative economic burden of unsafe food is highest amongst lower middle income countries. These are countries that are experiencing rapid dietary change, rapid urbanization, so a wider exposure to food safety hazards, and yet the predominance of a food system that's informal. It's still, most of the distribution of high-risk foods goes through informal distribution channels and is largely anonymous. And that basically capacity is lagging behind the increased need in those countries. And then by the time a country reaches upper middle income status, this begins to level off, where the capacity both in the public and the private sector begin to catch up, and consumers become more activist also in protecting their welfare. So we basically look at a variety of factors on the demand side, on the demographic side, and whatnot. So this is sort of the conceptual framework. Very much has this notion of a food safety life cycle. Next slide. And somewhat to our surprise, some of the numbers actually comply with this. So when we look at this, what we call the productivity loss from unsafe food in relation to the size of food expenditures, we sort of get the similar type of curve where it starts off at sort of a modest level among some of the lower income countries, rises up for the lower middle and some of the upper middle income countries, and then plummets after that. It doesn't mean that the costs of unsafe food are not high in a wealthy country. It's just relative to the size of the food market, they're relatively small. And somewhat surprisingly, we found the same pattern when we looked at trade and trade rejections, that low-income countries tend to have sort of narrow food export industries with some lead firms. And when you get into the middle-income countries, you get much more entry of many additional companies. Things go awry a bit, so you have higher levels of rejection amongst some of these lower middle-income countries until the industries again sort themselves out, both through public and private action. And then after that, rejection levels tend to plummet. Next slide.
Okay, this is over to me. Well, in the study that we did, benchmarking food safety wasn't the predominant focus, but the work that we did certainly illustrated some of the challenges that are likely to be faced in trying to do that. And there are challenges on the sort of outcome performance side and the capacities and regulation side. And this slide sort of summarizes these. I mean, obviously, it's not surprising that there are huge data limitations when it comes to low and middle income countries, which means that we have to rely on statistical models. And we used a lot of the data from the third group. The challenge there is that these tend to be published at the sub-regional level and not for individual countries. And so they can act to show that the numbers are big, which can be important in terms of unlocking resources, can be important politically, nationally and internationally, but is not particularly useful diagnostically in terms of saying where the big problems are. Because of that, there tends to be a lot of focus on outbreaks and data on outbreaks, and especially where these are associated with recalls. so and that tends to focus our attention very much on things that are conspicuous. But we know very well that this is very much the tip of the iceberg, that the sporadic cases we have very little data on, and so we tend to focus on these incidents that are big and conspicuous, but may very well represent the minority of the total. When it comes to trade, again, we tend to focus very much on the conspicuous, and in particular, the data that we have on rejections from low and middle income countries into high income countries, so US, EU, Japan, Australia, and so on. But these are very difficult to interpret, because what they tell us is where exports actually happened and where rejections occurred. They don't tell us about where exports are being curtailed, where exporters choose not to export because they perceive, whether they're real or just perceptions, that problems are too great. They don't. We often ignore the learning effects that come from these things, and so on. And so there are a lot of challenges on the what we might call outcome or performance side. When we come to the capacities and regulation side, at least on the face of it, it seems that we have a little more data. But there are still a lot of issues and challenges there as well. So we have a number of tools that provide objective assessments, whether it's a phytosanitary capacity, veterinary capacity, and food safety capacity, and so on. But most of those are restricted. They're not publicly available. They tend to be very sensitive because they are perceived to have a sort of signal value. So when you get a weak assessment, they show that there are problems, and that may signal to potential importing countries that they need to take care. We do have, for example, the WHO's international health regulations core competency data. They're sort of data that is more widespread and publicly available, but they tend to be on the basis of yes, no. So do you have something or don't you have something? For example, in terms of law, it tells us very little about the quality, about levels of implementation, about enforcement, and so on. When it comes to regulatory delivery and how consumers see the safety of food, we have very limited data. Data we do have tends to be for very few Asian countries that are rapidly transforming and or upper middle income countries. There are some examples of more in-depth assessments. For example, UNIDO did a very in-depth quality infrastructure survey, but these tend to be one-off. They tell us very little about how capacity is changing over time. When we come to broader issues of food safety management capacity, that's where we tend to, and particularly when it gets to the sector, this is where we know very little. Most of the focus here tends to be on the public sector. We would argue that in terms of benchmarking, the work by the Conference Board of Canada is probably a good starting point. But this is very much focused on OECD countries where we have far more data, where value chains are more formalized, and so on. Steve, back to you.
Okay, go to the next slide. All right, so just wanted to illustrate some of the material that we utilize that maybe is amenable for comparative analysis, but maybe not in the form that it's in now. So the FAO, and you're going to be speaking with Renata soon, the FAO does very in-depth assessments on food control systems. And, you know, we just picked up from, there was about eight studies done in Southeast Asia and South Asia. You get sort of some common issues, and they go into great depth in terms of the institutional structures, the regulatory, the status of regulations, their approximation toward international practice, and a variety of other things. They're not quantified, though. So you read it and you get a sense of the relative strengths and weaknesses, and then there's tends to be long lists of recommendations, but things are not directly comparable because there's no attempt to sort of quantify these dimensions. Next slide. So there are some tools out there that do quantify, and one of them is the OIE PBS assessment. So the OIE does these assessments of veterinary services. I think they use about 38 criteria. They've done it for 100+ countries, and about a third of those criteria have pretty close relationship with food safety because they relate to inspection, capacity for inspections of production, of abattoirs, of traceability of animals and products, laboratory quality, things like that. Now, many of these assessments are not in the public domain because of the requests by the nations. They're done by experts. They're very thorough, and they're both qualitative and quantitative. So there's a rating system. It's on a 1 to 5 scale on these different capacities. They also do an assessment of the financing, the adequacy of financing of these services. So we made some quite extensive use of this because for many developing countries, animal products are a leading or major source of foodborne disease. So, and we had also some data on foodborne disease attributable to animal products. So we're able to make some linkages. But I mean, what you find is that the vast majority of low and lower middle income countries have very low rated capacity. And so these are the, rated 1 and 2 in the OIE rating scale, which is really inadequate. And it's a completely different story with the upper middle income countries like Malaysia and China and Argentina, et cetera, where a majority or a significant proportion of those countries are having rated adequate capacity in most of these elements. We also drew from other sources to try to see the dispersion of capacity in the private sector. So global gap certification, organic area certification, companies that are registered by the FDA, companies that are recognized by the EU to supply either fish or meat products or whatever. None of this is in the public domain. I mean, the numbers for these tend to be summarized in highly aggregated form. So we got the data by country and whatever, and you can do some analysis. But it does show, again, sort of a skewed distribution. You take the top 10 or 15 upper middle income countries, and they dominate these registered firms or areas under global gap and whatever. And these are the same countries that dominate the developing world's trade in food safety sensitive products. But so we can make use of this, but you're restricted in terms of country, representing this type of data in a public forum. Next slide. So we did do some analysis of the OIE numbers. We developed a sort of capacity index based on the 13 criteria that we pulled out. The FERG team was also doing more work on the attribution of foodborne disease to animal products. And so we draw a connection. This is for African countries, and lo and behold, there's a connection. The countries with better capacity in these pertinent veterinary services have a much lower incidence of foodborne disease attributable to animal products. So capacity matters. I mean, we know this in the trade dimension because we were able to draw connections between certain certifications and capacities and whatnot and market access. In the domestic setting, we generally don't have this linkage. So it's actually been quite difficult to make the case to ministries of finance that capacity pays. And this is one of the few examples, that we are able to generate with this relationship. Next slide. And related to this is that you get what you pay for. So this is the, again, these are the African countries. This is the burden of foodborne disease from animal products expressed in dailies per 100,000. So it's a huge range. You wouldn't know that because the FERG numbers that are reported in the publications only report not by country, but by region. So you've got Eastern and Southern Africa, and then you have West Africa. So you see very little variation, but the underlying numbers are quite varied, but they're not published as such because of data limitations and concerns about having to negotiate these numbers with the member states. But anyway, there's widespread difference, and that the countries with the lowest burdens are actually the ones who have been investing adequately. That's the countries in green here. That's the ones where the OIE has assessed that their funding for veterinary service is adequate. So this is a little bit of a smoking gun in terms of a positive story of you invest relatively modest amounts in some of these capacity, it pays off in terms of a lower food safety burden. Next slide. I think it's back to you, Spencer.
Yeah. I said that the primary focus of the work we did was not on benchmarking, but we did give at the conclusion of that work some thought to the role of benchmarking and how we might go about that. And we, as our starting point, we gave some thought to things like, why do you want to benchmark? Who do you benchmark to? And very importantly, who do you want to communicate the results to? And that was actually a very big issue and a big predominant driver of the work we did. We were actually aiming the work that we did not at food safety professionals or experts, but actually at people who hold the purse strings. In terms of principles, I mean, obviously, benchmarking needs to be based on objective / expert assessment. It needs to be quantifiable. But very important here is interpretive ease. That is, yes, we want reliable, we want representative benchmarking, but it doesn't want to be overly complex so that somebody who's not a food safety expert doesn't understand it. Secondly, the benchmarking has got to be available. It's got to be publicly accessible. And it's got to be manageable in terms of cost of assembling and maintaining the databases that underlie it. And finally, in terms of focus, we have put a lot of emphasis not on outcomes, for one reason, because the data is so unreliable, on capabilities and commitment. And importantly there, we think that commitment is a critical issue here, particularly low income and lower middle income countries, but across the spectrum of developing countries. And so in terms of categories, on the other side of the slide, you'll see that commitment is at the top of here, which in some ways is unusual. So yes, we have capacity in the middle here, but we regard commitment as critical to any effort of benchmarking. So this is things like policy commitment, coherent stability, and resourcing. Not only resourcing in terms of investment in, for example, building a laboratory, but in terms of operational and contingency funding so that any capacity that is established can actually remain relevant and operational. And then at the bottom, we have the category of catalytical outreach. That is that any capacity actually induces an ongoing process of capacity maintenance and development within both the public and in the private sector. So here we're looking at issues to do with certainly information and communication, but also incentives and facilitation within the private sector and across both the formal and informal sectors. Steve, is there anything else you wanted to say?
No, that's all. So I guess we have a couple minutes so you can take questions from the committee, and we can, if there's any other questions afterwards, if you wanted to follow up, we can follow up with you also.
Great. Thank you very much, Stephen and Spencer. Let me ask the committee questions. If you do have questions, indicate by turning your name card up, and please identify yourselves briefly at the beginning so Stephen and Spencer know who you are. So let's start here with Jono, and we'll go counterclockwise. And remember to use your microphone.
Yes, thanks very much to Spencer and Stephen. We actually were saying yesterday that we needed evidence for advocacy, and there seemed to be a gap, and you've filled it in the last 40 minutes. That's great. One specific point on, and I think it's a Spencer, when you were talking about the WHO International Health Regulations and what you got from that and those assessments, it wasn't clear that you were using the latest joint external evaluation, which, I mean, that area has moved dramatically in the last 3 years, and with the 2016 and then the 2018 edition. And so that they do have a food safety module. But the question is on how, and this is a broader one for those of us who don't know food safety, how you're defining it. So if we look at drug regulation, we went through a phase, and it was progression through emphasis on quality, then safety, then efficacy. And it's hard for us to remember. It took decades before we even asked the question whether something was effective. And usually each stage was a crisis, and then proposals and resistance and all. So with food, I mean, quality is it what it says it is? Safety is, if it is what it says it is, will it, I mean, this is with medicines, will it harm you? And then the efficacy is, does it actually make you healthier? And so for food, I understand we talk a lot about food-borne illness. That's the safety part. Will it harm you? But are we talking at all about the nutrition side of it? Will the food make you healthier? Because there's more and more engineered food where the actual supply is engineered to be more addictive, but it's a less healthier combination. So if we look at food safety and the SDGs and link to the 10 or more SDGs, the link to health is important. So how when you say it's the health cost is 20 times the trade cost, are we looking only at foodborne disease or the total impact of food on the food supply and health?
Yeah, maybe I'll start and then you can come in, Steve. We were focused on foodborne disease with respect to the public health burden, and we were focused on compliance with food safety, specifically regulatory requirements when it comes to exports and border rejection. So we had that particular focus rather than wider costs associated with the nutritional quality of food. Steve, did you want to?
Yeah, no, it's good. We need to look at the 2018 version of the competencies. I mean, looking at the earlier versions, you would, a lot of it is around the existence of a food safety law and existence of this and that institution. Not so much about the functionality of anything. So you would see countries that you're familiar with that would have, let's say, an extremely high index or rating across the questions, and it's really a disconnect with what you see on the ground. So that was a limitation, but I will definitely be interested to see the last module to see whether beginning to get at the the quality of service, or the ability to deliver on the regulatory, enforce the regulatory structure. Yeah.
Thank you. We are going to have to stay on time. Renata Clark's going to be joining us if she hasn't. She has joined us. So what I'd like to do is urge our panel members to be crisp in asking your questions so that the responses we can get as many in as possible. And I'd like to be respectful of Dr. Clark's time and go to her.
Let's do that.
Stephen and Spencer, can you stay on the line? Are you planning to?
Sure. Yeah, I can stay another hour or so, and then
Okay.
it's yeah.
Wonderful, because we'll try to work in questions after that. So thank you all.